This is an active assisted knee lower. So I got a strap here. I'm typically giving this after a knee surgery or a big knee injury. So of course, if you're in that camp and I have not seen you, you should be under the care of a qualified healthcare professional. But if I've given you this, here's how, or if you're watching this, is how I like to do it. So I got a strap here. It could be a yoga strap, a belt, piece of webbing, whatever you have. And I'm gonna get it around the foot when I'm supported because I'm gonna swing my leg over. And typically when we start with this drill, the quad can't support the whole leg. So I'm going to come here and try and squeeze the quad as straight as I can with no more than a 3 to 4 out of 10 pain. I'm going to take an inhale, and on an exhale, slow exhale, I'm going to begin a slow lower, trying to use as much of my own muscle action as I can to control it, but as much of my hands and my arms as I need to control it as far as I can lower it to about a 3 out of 10 discomfort, no more than that. Even a 2 out of 10 is okay to start. And at the bottom, you're going to take an inhale and a slow exhale, softening and sinking on that slow exhale. And you're going to take a second one just like that. Inhale, slow exhale. And sometimes we'll get a little further as we exhale, but if not, that's okay. Then you're going to try and squeeze your quad to come all the way back up to straight, using your hands if you need to support. So as much as you can with your own muscles, as much as you need to with the strap. Take an inhale and an exhale at the top, and then begin that descent again. The descent should take 5 to 10 seconds because we don't want to rush this. And then another 2 breaths with that slow exhale, and then we'll repeat. And I typically go for 2 minutes or so, maybe 15 reps, so we're getting some cycles in here. If this is too much, like you don't have the flexibility, or this is a little nervy or something, you can do this reclined back. You could do it just leaning back like this, or if you have a recliner, a couch, something where you can lean back a little bit, that is totally fine. We're just looking for the knee motion on this one. So note about the breathing and not pushing into discomfort, not going quick. We're playing with the nervous system there. So typically I give this after a big knee injury or surgery, and the nervous system is all ramped up and protected of the area. Even if you were under anesthesia, your nervous system knows that a surgery happened, that you were cut into, and it's going to want to protect that area. And a lot of, I think, the motion limitations we see after surgery, they're multifactorial. There's swelling, things happen in the joint. But a big factor, in my opinion, is what is the nervous system doing? Because there's some cases where we're not getting motion and they go under anesthesia to try to get more motion, and they knock the person out, and all of a sudden the joint moves a lot better once they're back under anesthesia. And that's a clear sign that the nervous system is protecting the area. We take the nervous system more or less offline and put it unconscious, and we get more motion. And so in my therapy approach after surgeries and big injuries, I do not want to force into pain. That's at least my practice pattern, because I think that is going to worsen nervous system sensitivity and protection around the area. And our breathing is a way into the nervous system. When we take an inhale and a slow exhale, we soften and we sink on that exhale. That tells the nervous system that we're safe. When we're in an unsafe environment, we don't breathe like that. We breathe high, we hold our breath gets choppy, and our breathing is a direct input to the nervous system that can ramp us up or it can bring us down. And we often find as we do a few breath cycles like this and go through a few reps, we start to get a little more motion. That could be because swelling is working out because we're moving it, could be because the tissues are lengthening, but I'm not getting a lot of tissue change in just a minute or two here. I might get some fluid, some swelling change. What I'm getting is some nervous system, what I'll call softening around the joint where it's less protective, allowing for more motion. So that's why I don't want to push into pain for a lot of reasons, but one of them is I don't want to ramp the nervous system back up around an already vulnerable area. Sometimes there's a time and a place to really push into discomfort, but I find it's pretty rare. At least how I practice and approach surgeries is I don't push very hard, especially initially, into the range of motion. Definitely not in the first few weeks, because I want to calm the nervous system. And I find that often we can get great range of motion improvements with that approach, and it's a lot more comfortable for you as the patient. So that's how I approach this one, and also just kind of general philosophy on some of that after a surgery. So hope that all makes sense. Give it a shot. But of course, on this one, injury or surgery, don't be trying to go it alone on your rehab there. Work with somebody who's qualified, who can do that with you.